Welcome to Pedo Teeth Talk, brought to you by the American Academy of Pediatric Dentistry, a podcast show that delivers cutting-edge ideas for the professionals specializing in pediatric dentistry.
Thank you for tuning in to Pedo Teeth Talk, where we bring you the contemporary issues important to you and your practice. Brought to you by the American Academy of Pediatric Dentistry. I'm your host, Joel Berg. We're here today with Dr. Ron Hsu of Vancouver, Washington. Dr. Hsu graduated from the University of Washington School of Dentistry in 2003 and obtained his pediatric dentistry certificate from the University of North Carolina, Chapel Hill in 2006. Upon finishing his program, he joined a large DSO-supported group practice in Washington State and for over 10 years practiced clinical dentistry as well, and he also participated in clinical leadership and management. He opened Storybrooke Dental in 2017 and has built a thriving private practice in the last 3 years. He's an active member and a fellow of the American Academy of Pediatric Dentistry, having served on the editorial board for 12 years and the Council for Continuing Education for 5 years. This is Ron's second appearance. He was a guest/host on Pedo Teeth Talk at the very outset. So, Ron, thank you so much for being with us today.
Well, thank you so much, Dr. Berg.
So, Ron, you and I talked just recently, and we keep in touch. And just for the audience's benefit, I met you when you were a senior and dental student. You were president of the senior of the class. You exhibited a lot of great leadership skills back then in terms of how you communicated, how you were an advocate for the students. And now today, you're in a different role. You've worked both in a DSO environment and now in your own private practice. And we're all faced suddenly with dealing with this COVID-19 crisis. And I have been following some of what you've been posting and things you've been talking about. And I think you, as with many others, have really stepped up and taken a leadership role. And I wanted to share with our audience today some of the things that you've done to date. So I want to start by asking you, Ron, when did you become aware that this is really a problem, and then what did you do? And tell me if you can go into some detail about what you've done to deal with that.
Sure, yeah. So as you know, that Washington State was where it all started back in January 20th. That sounds like a lifetime ago. January 20th was when that very, very first confirmed case in the United States was found. It was in Snohomish County, just north of King County, where Seattle and Kirkland, this little town that's becoming quite famous, are. And back then, it didn't really make a whole lot of noise. There wasn't even a lot of details coming from China. So it was kind of a blip. But a month later, by late February, it was pretty darn clear that something bad was happening. So my manager and I decided to start asking questions during our confirmation calls. And so when we do our confirmation calls and send out confirmation texts, we actually added verbiage in there saying, asking our patients and families, hey, did you recently, like within the last 10 days, travel to King County? Did you visit family, friends in Seattle, in Bellevue, in Kirkland? And, did any of you feel a little bit sick over the last 10 days? We even went as far as saying, hey, if you, to your best knowledge, any of the people you've been with over the last 10 days, do you know if they got sick? Mm-hmm. And things like that. So we started doing this type of triage on Monday, March 2nd. And then by Friday, the 6th of March, we had a first confirmed case in my county, Clark County. And what really kind of raised all my alarm bells is that this case in Clark County apparently has no known connections with any positive cases and no significant travel history.
Yeah.
So to this day, I believe that gentleman have unfortunately passed away. To this day, we still don't know how he got it. And so once that started happening, I changed my message. So this is, Friday, March 6th.
Right.
By Monday the 9th, our message, we stopped asking about travel to King County. I mean, we figure it's already here.
Right.
So we really started asking, does anybody in the family been sick? And if you are, call, we're going to reschedule you. Really confirm that all the people you've been with in the last week or so, have any of them been sick? That type of thing.
You were way ahead of the game.
Well, by then I was reading a lot, and I was trying to figure out, okay, just what is this? And as you might recall, back, right around the time I was graduating and you were coming to University of Washington, SARS was wreaking havoc in Asia.
Right. 03.
And and I know that was a respiratory issue, in coronavirus. So I begin to be really concerned about the fact that, can we have this airborne transmission?
Yeah.
So I really just try to read everything I can. And then, of course, I started asking about these type of triage questions on Monday the 9th. And by Friday the 13th, our governor, Jay Inslee, has shut down all the schools.
Yeah.
And so at that point, then, the discussion really becomes, should we shut down too? And so Friday, my kids came home saying their schools were closed till the end of April. I go, okay. And online, people are debating, well, can we do this? Should we do this? Do we need to do this?
Mm-hmm.
And so I think that Saturday and Sunday, I probably spend, 80% of my waking hours online, just reading and asking questions and looking up sources. By Sunday evening, 5 p.m., my manager was asking, so what are you going to do? What are you going to do? So at 5 p.m. Sunday, I was like, we've got to close.
This is the 15th of March.
Yeah,
Mm-hmm.
yeah.
Mm-hmm.
And then so we were closed as of that evening. We start texting everybody, canceling all Monday appointments, Tuesday appointments. And we basically just canceled that week. And at the same time, I was working up a protocol. If we do have to see patients, what are we going to do? So I have all the triage questions on there, and then start having a step-by-step. Okay, the moment they come through the doors, everybody gets hand sanitizer on their hands. Anybody who doesn't have an appointment will be invited back to their cars.
Right.
We're going to measure temperature of everybody. If they come back and we are going to do something, do an oral rinse, 1% hydrogen peroxide for a minute. If we do actually have to do work, can we rubber dam it, isolate it, do something to isolate the tooth, and then scrub betadine on the tooth? I'm just, based on everything, I was just thinking about things to do.
So you started educating yourself, you said, and you did all these things, it sounds like, before there were sort of official entity recommendations to do some of those same things. Did you make those decisions and develop these protocols based on your own perusing the environment and internet and educating yourself?
Yeah, pretty much. Yeah.
So you didn't pull down stock protocols. You created these protocols yourself.
Yeah, just based on the various recommendations. Well, from different places, I read that betadine, hydrogen peroxide has the ability to kill. And I actually confirmed some of this stuff with Dr. Jeremy Horst, who's been, a previous guest on this podcast as well, and very active in silver diamond fluoride research. But what people might not know is that he used to be in the same lab with some pretty top-notch
virologists.
Microbiologists, virologists as well. And so we chatted about, what can potentially kill this thing, and how do we keep ourselves safe and keep our staff safe. So yeah, as I find these facts, and as I try to apply knowledge I had when I was studying biochemistry and taking all the pre-dent courses about airborne pathogens and stuff like that, some of these things just starts to gel together.
Yeah. So you started to realize that all these basic sciences had value beyond just getting into dental school. They actually had practical value in educating yourself.
Oh, absolutely.
Yeah.
So we started doing all these things Sunday night, and by Wednesday, Governor Inslee came out with a proclamation and shut down all non-emergency procedures all the way through May 18th.
So that was in part based on the availability of PPE and didn't want to use them. Is that correct?
Well, there's part of it is that, part of it is, I believe, social distancing, and I'm sure somebody advised him that, based on CDC guidelines and researches in the past, that airborne stuff, when you have airborne pathogens, dentists and apparently dentists and ENTs are way off the charts for a risk level.
Yeah,
and so I think he hopped on that pretty quick.
Right, and there were a lot of things floating around. Of course, at the end of all of this, we're going to have to sort out what's correct and what isn't, because there's so much information. We don't know what's been documented. I wanted to shift gears for a moment, Ron. You grew up in Taiwan, where I visited myself many times. I love being there. They've done a pretty good job, according to many parties, in managing through this crisis. What did they do? Can you tell us a little bit about that?
Oh, yeah. So, it's true.
And if you have any dental connections about what they've done, I would like to hear that too.
No, nothing dental specifically, unfortunately. But what they did do was that, after the SARS thing 16, 17 years ago, it hit them pretty hard. So they had kind of a debrief from there, created all these contingency plans, and had all these trigger points where they would, if this was to happen again, how do we manage it? So, but when because of the pressure from the Chinese government, even the WHO was not very forthcoming with information to Taiwan. And so people in Taiwan had to kind of find their own
way
clues. Yeah. So
kind of like you did in your office, I would say.
Right. So interestingly enough, China did allow a team from Taiwan to visit Wuhan on January 12th. But that's 13 days after China reported their findings to the WHO. In the moment they reported it, Taiwan actually began to immediately start screening all passengers coming from Wuhan. And not only that, they actually went back to flight records and start contacting everybody who landed in Taiwan 10 days prior to that. And so because of the lessons they learned from SARS, they acted very, very, very quickly.
History is a good teacher, and I think that we'll all be better prepared. But that's a really good thing to learn more about, and I think we all will. I wanted to ask you how your team is doing, how your employees are doing at the moment.
Well, I hope they're okay. I do worry about them mentally and emotionally. We were pretty lucky that we had a pretty great start of the year, so there was some cash cushion after 2 great months. January and February was kind to us. And so what we have done is that as soon as I made the call to close, I told my staff that I will continue to pay their regular wages, And so they got their regular pay through the entire month of March. In fact, money should be hitting their accounts in today or tomorrow. And then so what I did was I told my manager to do some math and tabulate and average out what they've been getting paid between January and February, and we were just going to go ahead and carry that average pay forward. And so with the cash reserves that we have and the business line of credit that I had paid off at the end of last year but left open, and the fact that my practice loan bank told me that they can defer my loan payments for 4 months, I feel confident that we can at least take care of my people, people financially.
Right. And of course, we have, yesterday I spoke with Mike Graham from the ADA Council on Government Affairs. He's a leader in government affairs, of course, and he talks about the CARES Act, and I won't go into that with you right now. But, we all should know about what's available. There are some good things that will help everybody. But your story is a great story of stepping forward. I wanted to move to a different topic in our last component here.
Sure.
And first ask you, has anyone from the medical community reached out to you? I know that your county, the Dental Society leaders were featured. I remember I contacted you because I saw it in the ADA News about a year ago about medical-dental collaborations. And I've spoken to myself in your county and have observed this really close medical-dental collaboration and a lot of initiatives. So have they reached out to you or the dental community for assistance now?
It's surprisingly no, but there was some general calls. There were some general calls for donation of surplus PPE. But there hasn't really been anything specific coming from the medical community, which I think is quite a shame. I mean, most of us have not much to do now except, tuning into podcasts like this or watching webinars. And I feel like we can probably at least help triage some patients, and to help either do Zoom diagnostics or something to at least to help screen. I did reach out to my local pediatric ED group of doctors. So this is the Peds ED professional group, and they were short. They were feeling a pinch on PPE, so I was able to donate about around 1,000 masks, maybe 250, 300 disposable gowns, but that's about it. I mean, I love to help in some other way, but they haven't really told us how.
Well, I think that's one of the areas, one of the outcomes of this crisis will be to look at how we can together work towards things like this in these situations. We can be hopeful that we can work together and provide services, including, as you said, maybe others have said that the dentists are essentially trained close to being a paramedic in terms of life support and ACLS or PALS training. Those kinds of things, in addition to triage. So there's a lot of things that are going to come out, and I think that'll be one of the many. I wanted to, in the last part of our conversation, talk to you about, and this is something that you see a lot of discussion on on the social media, and things have emerged from sort of like crisis panic to make sure I take care of my business and my family and our people who we work with, and now we're starting to talk about what does going back to normal look like. So first I want to ask you that from the perspective as a practice owner, which you are now. Then I'm going to follow up and ask you, what do you think the DSOs will be doing in this regard? But I think let's talk about as a practice owner, how soon do you think this will happen? We don't really know. But what do you see just briefly now needing to happen to get back to quote unquote normal?
Well, so if all these lockdowns, stay in place orders are followed, and we actually see the curve change within the next 3-4 weeks, then the likelihood of us maybe resuming limited activity by early summer, that could be a possibility. at this point, Washington is shut down till May 18th. Oregon is shut down till June 15th. I think that's probably the best case scenario if everything goes really well. If not, it could definitely reach into the summer unless some miracle cure comes along or some possibility of being able to mass test everybody. And then we are able to separate out the negatives from the positives and do all the contact tracings and all these things that these little Asian countries are doing. Normal might be a ways out.
Well, I think regardless, and again, we don't know at this stage, but it sounds like in the same way that you were ahead of the curve yourself in terms of the decisions you made early on, to check temperatures, to ask questions. You did all these things before there were edicts that you must do them. I suspect that you, and I think you'll inspire all of us to think about what we can do for ourselves and to predict what we might have to do and then alter according to what's required. Is that a fair way of looking at it?
Yeah. Well, and that's the thing. I mean, the more I think about it, the more I think there's probably not a old normal that we can go back to. There'll probably be a new normal that we will be having. We as long as the virus is swimming around, we have to worry about aerosols. Right. Anytime we try to do handpiece work, we probably will have to have eye goggles and properly fitted N95s, disposable gowns, caps, and things like that.
Yeah, many of us in the generation before you, I'm more than a little bit older than you. I was involved in treating some of the first HIV positive patients, hemophiliac children. And I remember the feeling was very similar, how are we going to reemerge? And even though we obviously soon discovered that it can't be, it's not airborne, it requires bodily fluids to transmit, we did not know that at the time. So the assumption, the working procedure was that it could be received just in the same way that, that COVID is now. So because that was our perception, we had the same feelings and we conquered that, and we will conquer this too. I want to just conclude with one quick question on the same question. Going back to normal, you worked at a DSO for 10 years. They have, I think, one of the big, advantages, if you will, and why many pediatric dentists are forming their own groups is that a larger group, whether it's a DSO or just a group of people together, have systems and metrics and things they can do, procedures they can implement uniformly. Do you think that's going to be a major advantage at this point for a DSO?
Well, the big advantage for them is probably, again, going to be cost savings when they order massive quantities of these PPEs.
Right.
That whenever the supply becomes adequate again. Having a centralized message, having all these infection control practices in place and strictly followed, that will be really great too, rather than each individual private practices trying to come up with their own thing. That could be more effective. On the other hand, it depends so much on the clinical and managerial leadership of these DSOs. Because a couple of weeks ago, when all the shutdowns were beginning to be talked about and happening, apparently there were still quite a few groups that are resisting the call. They are saying, "Oh, these are just guidelines and recommendations," and these are coming from essentially advisory and professional groups. These are not, edicts and law enforcement.
Government entities,
Right. So I think what the DSOs what they need to be careful of is to make sure that they listen to the science rather than paying attention to the bottom line only,
right,
and to do the right thing. Yeah.
And I think in the end we all are and we all will. Ron, I wanted to thank you very much. You've given us some really good information. It's inspiring to see how you acted, and I suspect you and now those who are listening to you will respond in similar ways. So thank you so much for being with us today.
Well, I really appreciate the opportunity, and thank you for all the mentorship and all the the good discussions over the years. Really appreciate it.
Thank you. And thank you for tuning into Pedo Teeth Talk, where we bring you the contemporary issues important to you in your practice, brought to you by the American Academy of Pediatric Dentistry. I'll see you here next time.
Pedo Teeth Talk is brought to you by the American Academy of Pediatric Dentistry, the show that delivers cutting-edge ideas for the professional specializing in pediatric dentistry. If you have any questions or comments, please email info@aapd.org. We welcome your ideas for future shows and guests. For more information on the American Academy of Pediatric Dentistry, visit aapd.org.